Welcome to the Osmosis Daily Report on the Coronavirus Pandemic. I'm Dr. Rishi Desai. I'm the Chief Medical Officer at Osmosis. I'm also a pediatric infectious disease physician, and I used to work at the CDC in the Division of Viral Diseases doing outbreak research. So today we're going to talk about coronavirus and how long this pandemic is going to last. There's a great website on COVID-19 projections from IHME, and first and foremost, I want to just draw everyone's attention to this part right here. All of the projections assume full social distancing through May 2020, so that may or may not end up being the case based on how various governments lay down their rules, but these projections assume that through the entire month of May, everyone continues to isolate as aggressively as they're currently doing in many states. So what I want to draw our attention to is that this is a model for the entire United States, and you can see the peak, which is right here, this kind of purple dotted line. It's on April 11th, 2020. That's the peak projected date of resources needed, like hospital beds, ventilators, etc. So that's the idea in terms of how this model is created. It really averages out across the United States, and April 11th is what they declare the peak, meaning a few days ago. It also assumes that most of this will be over by June 1st. You can see by June 1st, we're at the very tail end of this curve. So you can see this differs by state. Washington State was hit first, and they peaked out on April 6th. At the other end of the spectrum is Wyoming, a state that really hasn't seen the brunt of this yet, and their peak is scheduled to be around May 1st. So really, the state-by-state piece is what I think is going to increasingly matter for us. Now in the US, testing has been ramping up, but it's still not at the levels of Germany, for example. So I wanted to look at a country that we know is testing much more aggressively to get a sense of how much they're seeing in terms of cases versus mortality. In Germany has some published data. This is an article that shows that they basically have done about 920,000 tests of folks through late March. By comparison, in the US, we had done just over 1 million. So actually, more testing had been done by end of March in the US than Germany, but here's the catch. Their population is obviously much smaller, so as a percentage of their population, they had much, much more data than we had. So this 920,000 people then, out of a population of 83 million, is about 1.1%. By comparison, given our population in the US is around 328 million, we've done roughly 0.3%. So now we know how much Germany has tested, at least by end of March. Looking at today's data, they've had 127,459 cases, and among them, 2,996 deaths. So that works out to a mortality rate of about 2.4%. So going back to this data then, if you look at the total number of deaths that we expect to see, it's around 61,545 projected deaths. If you apply that percentage mortality that we're seeing in Germany, if that's true here as well, then that means that this only represents 2.35 or 2.4% of all the actual cases. Multiplying that out, you've got roughly 2.6 million cases of COVID-19 in the US. That sounds like a lot, and it is. But 2.6 million COVID-19 cases represents less than 1% of our US population, meaning that 99% of the US population will still be vulnerable to COVID-19 after all this is said and done by July, if these projections hold true. And so even if we're off by a factor of 10, let's say, in terms of the mortality rate being much, much lower or anything like that, that still means that we're in the ballpark of 1 to 10% will have immunity to COVID-19, but that 90 to 99% will not. So this just has a lot of implications for how we think about the disease and how we think about reopening up our country, because at any point if we decide to reopen the country, we have to be thoughtful about how to protect people, given that so many people will still be vulnerable and have never really had exposure to COVID-19. Thanks for tuning in. I hope you found that helpful. Hit the red subscribe button and the bell icon for daily updates. Check out osmosis.org/COVID-19 for all of our resources. Remember to do your part to raise the line and flatten the curve. We're all in this together. Thanks.